if there is a pregnant or postpartum person in your life, make sure that when they interact with the healthcare system, they always bring someone with them. We should not be going at this alone. This system was not built for people of color, for people who don't speak English as their primary language. So you always want to bring someone with you.
Greetings and welcome to When the Moment Chooses You. I am your host, Coach Charlene, and I am extremely excited and honored to have Dr. Amanda Williams with me today. Welcome to the show, Dr. Amanda.
Thank you so much for having me. I'm glad to be here.
Yes, I am very excited to have you here. Now, I have to say how I met Dr. Amanda. I don't know what virtual education we were on, but I was actually doing my master's QI project, and I decided to do it on perinatal services and the different communication issues and challenges that women of color have while birthing. And so I heard her speak, and I was blown away just with her wisdom and the tools that she gave. And I mean, just everything about it. I don't even think I closed my mouth on her talk. So I just had to reach out to her because of the passion that she has for this work. So Dr. Amanda, can you tell us a little bit about yourself? And then I would love to know, honestly, this moment that I believe that totally chose you with our Black mommies. So can you tell us a little bit about yourself first?
Sure. Whenever people ask that question, I always wonder where to begin. So I will tell you what I do now is I am the medical director of a pregnancy wraparound services company called Mahmee that fills in the gaps of traditional prenatal and postpartum care and is grounded in health equity. So we provide services like care coordination, perinatal nursing, lactation, doula services, mental health coaching, nutrition coaching, all those things that make people whole, but that they don't necessarily get. And we do it with cultural sensitivity, with a lot of cultural concordance. We have 3 times the population, sort of birthing population, overrepresenting Black people. And so it is really exciting to be able to design care with this group of people. And then I also keep my toe in the policy and academic waters. I am on the adjunct faculty at Stanford and am a clinical innovations advisor for the California Maternal Quality Care Collaborative, which is the CMQCC, which yes. I know you know. And we're putting policies and practices and toolkits, doing webinars to try to decrease maternal morbidity and mortality in hospitals in the state of California. And in particular, my work is centered on shrinking the disparities for Black birthing people compared to their white peers. Now, one of your questions was, how did I get here?
Yes.
And, I say that either I have lost my mind or and the jury may still be out. I left my big, stable leadership job at Kaiser Permanente to get off the aircraft carrier, get on the speedboat, because too many Black moms and babies were dying, and I could not wait. I had my own complications of childbirth 18 and a half, almost 19 years ago. And I was the chief resident at UCSF. Like, I could not add more intellectual privilege, academic privilege, access to care. And yet here I was having these crazy complications, not trusting my own body. And in retrospect, I said, well, if not me, then who? Right?
Yes.
Like, I have been given this tremendous privilege to have this training, have this education, have my own story, and have all of this organizational experience. I can't sort of keep my light under a bushel. Like, I can't just hold it inside of myself. I have something to give the world. And so when my mom passed away, about not almost 2 years ago, 18 months ago, in the middle of COVID. She'd been sick a long time, and there was something oddly liberating about when she passed.
Hmm.
It sort of emboldened me to say, okay, Amanda, now is your time. Now is the time when you are going to shine. You've walked with your mother through this illness. You've walked with all these patients and your teams and the doctors and nurses through the peak of the pandemic. You know that this maternal health crisis is happening. And now what are you going to do? Are you functioning at your highest and best use? And
Wow.
myself was no. And so I knew that I had to do things differently.
Wow, that's pretty powerful because I remember like during the murder of George Floyd and all of that happened in 2020 of all of the social unrest and everything. Remember, I went into prayer and what it sounds like, these words kind of fell into my spirit. What you do in this moment will determine your destiny and dictate your future. And so you actually, I mean, that's pretty bold to leave a very secure job and you jumped off and did something to follow your heart. So I always admire people that have the courage and the boldness and that risky, risk taking to jump out and do it. So people may ask, well, why? Why are we having so many problems in our African American population with Black mamas? Can you give us an answer to that? Or
Well, like a dissertation.
yeah, that is. We don't have enough time to discuss it all, you guys, but
the front page of every newspaper.
Yes, it is.
Today, because we just got the statistics from 2021 just came out showing that America continues to have worsening maternal death rates compared to other countries. And Black birthing people are still dying at rates 2 to 3 times that of their white peers. And so why is it? What is getting in the way? And I had the privilege of being quoted on the front page of the New York Times last month in an article that CMQCC had contributed to, looking at economics and poor outcomes for Black moms and babies. And the rates of neonatal death and maternal death for the wealthiest Black moms were still higher than the poorest white moms.
Wow.
So your money can't save you. And
Yes.
I appreciate people like Serena Williams, like Tatiana Ali, Beyonce, who've used their platforms to say, hey, she's the GOAT. And she still wasn't being listened to. The nurses were blowing her off when she was having an embolus. Like, this is crazy.
Right.
People, whether it's intellectual, academic privilege, or financial privilege, we still can't get anyway, we still can't be safe, then there must be something else going on. It's not just access, though access is part of the story. It's not just chronic conditions, though chronic conditions are part of the story. This is where racism has been deeply enmeshed in the US healthcare system. And we know that obstetrics is one of the fields where racism is the most deeply rooted. So whether it is involuntary sterilizations, whether it is Sims experimenting on people, causing them fistulas, and on the enslaved women who he was supposedly operating on, and that our history is full, and that disrespect continues today. That young lady, April Valentine, who died in Southern California just a month or so ago, she was tweeting and talking to her family the whole time. They're not listening to me. They're not listening to me. Now, I was not there. I do not know if them not listening to her could have saved her life. I cannot prove that. I do not know that. But what I know for sure is that she was being disrespected and she was not having an affirming or positive birthing experience. So there's a lot going on that is driving these health outcome disparities for Black women, and that is what I've committed my career to work.
Well, that's amazing. I know I don't have you for much longer, so I'm going to just actually jump in with Dr. Amanda's top three. What would be your top three recommendations for any of us out there that work in the field, providers, nurses, whoever's going to listen to this podcast? What would be Dr. Amanda's top three that we can do to shift this crisis?
For the maternal health crisis, or for your own career?
For your maternal health.
Okay, so for the maternal health crisis, the number one thing is, if there is a pregnant or postpartum person in your life, make sure that when they interact with the healthcare system, they always bring someone with them. So we should not be going at this alone. This system was not built for people of color, for people who don't speak English as their primary language. So you always want to bring someone with you. That would be number one. Number two would be if anyone is in any kind of position of power, if you are hiring people and everyone around you looks the same, then ask, what is getting in the way? Why don't we have diversity here? We are better when we have different ways of thinking about things, when we have different approaches. And we have to be able to be creative, to find new solutions. So that might be hard. It might mean that you have to not recruit from all the same places, that you might have to do blinded interviews. But if your staff, if your team is looking all the same, then you know something is wrong. And that is really something you can do. And then lastly, I would say listen. In so many of the cases, if you are a healthcare provider, we are paid, we are trained to make connections and to say, well, if you see this and this and this, it must be this. And so our brains do that. Our brains take shortcuts and want to make connections. But that also gets us in trouble. And that is where implicit bias comes from, when our brain starts taking shortcuts. So what we actually have to do is slow our brains down. So whether that's developing a meditation practice, a mindfulness practice, whether that's taking a deep breath and saying a mantra every time you walk in a room, whether it's listening to the last letter of the last word of your interlocutor, find a way to slow down so that you're really hearing what your patient is saying.
Wow, that's pretty powerful. And then one more question.
Yes,
you
ma'am.
are a risk taker. Let's encourage those out there that really have a passion in their heart to jump out and do something like you just did. So that, this sounds like your life's work from the way that you talk about it. So give us a tip for those out there that's kind of stuck.
I'm actually I'm not as courageous as one might think. I am, I do have 20 years of OBGYN experience. I've got a pretty good BATNA. I can always go back to practicing medicine if things don't work out.
Yes.
So definitely take risks, but make sure you got a plan B.
Yes.
You know that if it's not working out, it may just not be working out right now. It might need a minute. It might need to percolate. It might need to come around again. So don't be discouraged. Make sure you have a backup plan, but definitely keep following your purpose. Keep following your passion. I will tell you, this is not just my work. I truly believe that this is what I am on this planet to do. My number one job is to raise my Black boys and keep them safe and let them contribute to making this world a better place. And my number two, right behind it, is to make America a safer place for Black people to have a baby.
Well, you know what? I am so honored and so proud to know you and to know the work that you're doing. And I just say, keep on moving, because you inspire me every day that I go to work to take care of our mommies and our babies, to make things better for them. So thank you for all the work that you're doing. And if anybody wants to get in touch with you, is that possible?
Yeah, you can always reach out to me on LinkedIn. Is probably the best way to do that.
Okay, well, thank you so much for your time. And I hope I know everybody's been inspired and stirred up so that we can do better, because we owe our mamas better. We owe them more than what they've been getting. So thank you so much, Dr. Amanda, for being on the show.
And thank you for lifting up this message. I really appreciate it.
Yes, thank you. Thank you. We'll see you next time.